Welcome to the Burnaid channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for low oxygen saturation and impaired gas exchange. This condition occurs when the body cannot effectively exchange oxygen and carbon dioxide, leading to low blood oxygen levels. In this presentation, we'll cover assessment, interventions, desired outcomes, and evaluation to help manage these critical respiratory issues. Understanding low oxygen saturation and impaired gas exchange. One definition: low oxygen saturation refers to reduced levels of oxygen in the blood, often measured below 90% using a pulse oximeter. Two causes: impaired gas exchange can result from respiratory diseases, heart conditions, or environmental factors. 3 symptoms: patients may experience cyanosis, dyspnea, confusion, and rapid or shallow breathing. 4 importance: effective management is crucial to prevent organ damage and maintain overall health. Nursing assessment for low oxygen saturation. 1. Pulse oximetry. Continuously monitor oxygen saturation levels to assess the severity of hypoxemia. 2. Respiratory assessment. Evaluate the respiratory rate, depth, and effort, looking for signs of respiratory distress. 3. Lung auscultation. Listen for abnormal breath sounds, such as wheezes, crackles, or diminished breath sounds. 4. Skin and mucous membranes. Inspect for cyanosis and pallor, indicating poor oxygenation. Nursing diagnosis for low oxygen saturation and impaired gas exchange. 1. Impaired gas exchange, related to alveolar capillary membrane changes or ventilation perfusion mismatch as evidenced by low oxygen saturation, cyanosis, and abnormal breath sounds. 2. Activity intolerance, related to insufficient oxygen supply to tissues, as evidenced by dyspnea on exertion and fatigue. 3. Ineffective breathing pattern, related to increased work of breathing and decreased lung compliance, as evidenced by the use of accessory muscles and abnormal breathing patterns. Desired outcomes for low oxygen saturation and impaired gas exchange. 1. Oxygen saturation. The patient will maintain an oxygen saturation level of 92% or higher. 2. Effective breathing. The patient will demonstrate an effective breathing pattern, with normal respiratory rate and depth. 3. Absence of cyanosis. The patient will show no signs of cyanosis, indicating improved oxygenation. 4. Activity tolerance. The patient will engage in physical activities without significant dyspnea or fatigue. Nursing interventions for low oxygen saturation. 1. Oxygen therapy. Administer supplemental oxygen as prescribed to maintain adequate oxygen levels. 2. Positioning. Position the patient in a semi-Fowler's or high Fowler's position to promote lung expansion. 3. Airway management. Ensure patency of the airway by encouraging coughing, deep breathing exercises, and suctioning if necessary. 4. Medications. Administer bronchodilators, corticosteroids, or other medications as prescribed to improve airway function and reduce inflammation. Nursing interventions for impaired gas exchange. 1. Monitor ABGs. Regularly check arterial blood gases, ABGs, to assess the effectiveness of oxygenation and ventilation. 2. Pulmonary hygiene. Encourage the use of incentive spirometry, chest physiotherapy, and humidification to clear secretions and improve lung function. 3. Hydration. Maintain adequate hydration to thin secretions, making them easier to clear from the respiratory tract. 4. Monitor response to treatment. Continuously assess the patient's response to interventions, adjusting care as needed. Evaluation of nursing care. 1. Oxygenation status. Re-evaluate oxygen saturation levels and ensure they are within the desired range. 2. Breathing patterns. Assess for improvement in breathing patterns, ensuring they are effective and efficient. 3. Symptom relief. Confirm the absence of cyanosis and reduce dyspnea, indicating effective management. 4. Patient education. Ensure the patient and family understand the importance of oxygen therapy and airway management techniques. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for answers to more than 3,000 questions.